Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Now that the bonnets are completed, we're going to place a spacer on the dies. The spacer will allow room for the permanent cement as the restoration is seated, and will actually allow the restoration to go further to place and will actually increase the cemented retention of the restoration. The material we're going to use to provide the space is called die spacer, and it's a lacquer type of a paint. 2 coats placed evenly on the die should allow about 25 microns of room for the cement, which is about what we need. So we are going to take these dies. We have already cleaned them very well. We've taken all the Duralay lubricant off and washed them with soap and water, and even rubbing them down with alcohol would be a good move. These are very clean now. They have no more of the Duralay lubricant on them. If the Duralay lubricant is left on, of course, the paint will not stick. So we will just take these dies now, and after we have agitated the paint or shaken it well, we're just going to place a thin layer of die spacer to these dies. Now you'll notice that it tends to want to lake into the retentive groove areas, so we're going to have to come back and brush this area out. And I have probably a little bit more on that brush than I absolutely need. So I'm going to take and brush some of that off there. And we'll just brush this on. Now you notice I'm staying away from the margin, and I want to stay away from that margin about a full millimeter, because I don't want to put die spacer on the die next to the margin, because this would prevent a good marginal adaptation from developing, and of course that would work against us. This is the first coat. After this is dry, we'll come back and put a second coat on. Okay, the bicuspid die is very similar type of thing. Don't have too much paint on your brush. And we're going to come around this lingual cusp into the box area and part way out on the slice. Now obviously these slices are not too wide, so you can't coat that entire slice, or you're going to be involving the margin. And we want to stay about a millimeter away from that margin. Come through the occlusal area. And here we've gotten a little bit of spacer up too close to the margin. I'm just going to wipe that off before it has a chance to dry. Since this is a lacquer, the initial drying is very quickly. I've just finished coating the bicuspid die, and now we're ready for a second coat on the molar die. And we'll just simply put a second coat here, following the area that we described with the first coat. Now both dies have received 2 coats of die spacer material, and what we want to do is let these dry. If you don't let them dry thoroughly, the lubricant that you place on the die to separate the wax from the die will cut through the die spacing material and destroy it. We have previously put die spacer on our dies, and it has dried, and so now we are ready to go. The first step will be to lubricate the dies, very similar to what you did in your waxing exercise. And we're going to use the Nay dye lube, the same material you use to lubricate your plastic tooth when you were doing the wax the waxing exercise. But now we're going to be able to use a very, very small amount. You can use this a very thin layer, because the metal die will not tend to stick to the wax as the plastic tooth did. So you notice I'm putting a very thin layer on the metal dies. You can blow this off lightly with air so that you have a very, very thin layer, or you can very, very lightly blot it with your fingers. You obviously have to have some on there, but you don't want a actual liquid coating there. You don't want it swimming in those retentive grooves. You can see that the die is moistened, it's glistening, but the liquid is not laking into those retentive grooves. Next, we're going to warm this die by passing it through the flame a little bit, testing it on the palm of your hand, make sure it's the proper temperature. And then we're going to put the initial layer of wax on with a 28 gauge green wax. So we're just going to flow the initial layer in here, very similar to the way you did in your waxing exercise, a very, very thin layer. You should be able to see right through this when you're done. You don't want to get it so hot that you'll be searing it to the die. So control your heat. And just go all the way around the perimeter of that die. The initial wax adaptation for both dies is now done. You can see it's very thin, and it goes completely to the margins and over the occlusal surfaces on both dies. We're now ready to do our initial bulking of the retentive areas and the margins. So now we're going to switch to the harder green wax, the green inlay wax, and we'll just start out with a bicuspid here. First thing we're going to do is take some wax, adapt it into the box area, drop it right in there, and as that starts to congeal, we'll hold it down to keep it from shrinking out. Turn it around, do the same thing to the other box. And you can actually come across the isthmus, as long as you keep this thin, and get that adapted in there also. We'll now go to the margins on the bicuspid, and with this we'll include the slices and the buccal hood. And we're going to come around and put a bulk of wax right out where that margin would be. Remember, this is to be a over-contoured area. It's not overextended, so we're going right to the margin, and we're going to put a bead of wax around those margins. As you work, you'll overlap each area so that you have good adaptation all the way around the perimeter of this die. Then come right up over that buccal hood. Now the buccal hood, you're going to have to be cautious because this is an area that is going to be in function. Can't build that up too high at this point. And there we have the margins on this bicuspid have been bulked in. You can see that there's a little bit lack of bulk right up in this point angle here in the distal, so I'm going to put just a little bit more wax in that area. We'll now do the molar. Be sure that you come into each groove with the harder green wax, melt it right into that initial 28 gauge layer, and hold it down till it congeals. You do that with each one. Then we'll start working on bulking the margin of the molar. And we'll lay that bulk of wax right down to the margin, let it start to congeal, and hold it down. And we'll progress all the way around the perimeter of this die. Here you can see that we have gotten the initial wax adaptation done on both dies. We've come down, we've got a bead of wax all the way around the margins, and the margins are fully captured, and we have a very, very thin layer of wax over most of the occlusal surface. We are not contacting the stone on the distal of that first bicuspid, so you may have to trim that back and be sure that you're not hanging up on that first bicuspid. We now want to create some area for a wax pattern of the Pontic. In order to do this, we're going to have to put an awful lot of wax in this area. Now we could start waxing right on the ridge. That would take quite a while. So one useful technique to do, and this is going to maybe take a little practice for you, is to take about 30 millimeters or so of a stick inlay wax and cut it off. And you can use your wax dropper here, warm it just a little bit, and shove it into this piece of wax. Let that congeal. This will give you a convenient handle. And now we're going to warm this wax, and this is going to take 2 or 3 minutes to do. What you're going to have to do is start getting a fluid wax on there. Just hold it right in the flame and then run this around. You can see that bead of wax running around there. And this will actually warm the wax so you can mold it in your fingers. It's important you don't try to rush this too much. You can see now it's starting to drop off readily, very easily as I just put it slightly into the flame. So we're going to let that start to congeal, start to lose its gloss a little bit, and then we can pick it up right off our instrument and mold it with our fingers into a round ball. And you may get a few lap lines here as you do this, and after we have it molded, we can put it right back on our little instrument and melt that a little bit. And we're going to consult our model and see how much of this we have to cut away. Start forming this into a Pontic form. You can see that we've got it an elongated form here set on there, and now we have some wax. We can just cut this about in half, and we'll lute that to the ridge as a start for our wax for our Pontic. We have now carved this Pontic form back. We have trimmed it. Let's see if we can set it on the ridge there. And you can see that we have some about 2 or 3 millimeters between each abutment that we are going to need in order to develop the proximal surfaces of the abutment. And if we close the instrument, we should be out of contact on that Pontic form. And there you can see we do not have contact with that Pontic. Next thing we want to check is look down the Buccal surfaces, sight right down the buccal surfaces. Okay. You can see that the buccal surface of that Pontic is starting to line up with the buccal surface of the bicuspid. You can see we're going to have to remove, by carving, some of this more occlusal area of the Pontic, but we're close. So now we can lute that Pontic form into place, and that will be the start of our Pontic wax-up. We will lute it down to the ridge with sticky wax so that we can work with that form in that one position. We don't want to have to continue to try to balance that on the ridge while we're working. First I'll put an initial tack of sticky wax in there, let that settle. And when that is firm and is holding it in place, now I can open this up and we can really come in here and lute it securely to the ridge. You can see that that Pontic form now is securely luted to that ridge, and we've done the same thing on the lingual. And securely luted it on both sides. Now we're ready to start locating cusp cones. Now that we have the initial wax adaptation and the adaptation of the margins, the Pontic is in place, we can start arranging the cusp cones and the centric stops. Now, as you know from reading Appendix 3 and from your occlusion course, we want to try to put the cusp tip in a reasonably flat area, and we want to have a stop from centric occlusion to centric relation. So the first thing that we'll do is examine the opposing teeth as they relate to our wax up and see if we can find some places for those cusp to function in. Tip this up, and you can see that the second molar, the mesial buccal cusp, is going to want to come up inside and fit. It will not be going for the central pit area because that would put the cusp right in the middle of the tooth. We're going to be a little bit to the middle of that. So as we create this wax pattern, we may have to create a stop area on the opposing tooth. So our initial cusp cone placement is going to be here for the mesial buccal cusp, here for the distal buccal cusp, and we're not going to have a stop apparently in that central fossa, because with this particular mounting in this particular patient, that would really give us a crazy looking anatomy. So you can see now on the first molar that we probably will be able to have a distal coming into the distal triangular fossa of the upper molar, a middle buccal cusp about in the central fossa, central pit area, and a mesial buccal cusp out here somewhere approaching the mesial fossa of the upper bicuspid. Second bicuspid, you can see that the second bicuspid, the cusp tip is aiming towards the mesial triangular fossa of the upper second bicuspid, and that's exactly where we want it, because as we move into a balancing excursion, that buccal cusp will fall into the embrasure, and in a working excursion we don't really have a problem. So that should be no difficulty for us. So we'll start out by putting on the buccal cusp of that second bicuspid, and we'll simply take some wax on our wax dropper, come out here and drop the cusp cone, build it up a little bit here, and now we will close the instrument and test that position with the instrument. Close it down. If we can show you, it comes up in that marginal ridge area. As we move into a working excursion, it raises off on the cuspid, comes out of the way, and as we go into a balancing excursion, it's nowhere even close. And as we move into a freedom and centric motion, it rides on that mesial marginal ridge. So similarly, we will locate the rest of the buccal cusp tips. Now all the cusp cones have been located. You can see that we have indicated the 3 cusps on the buccal of the Pontic and the 2 on the second molar. If we close this down, you can see that as we outlined previously, you've got the 2 cusp tips on the second molar coming up in not an ideal position on that second molar because of the position of the opposing tooth, and the cusp tips on the Pontic are just about ideally placed. You can see that we have one on the mesial marginal ridge, pit, and the distal triangular fossa. If we move into a balancing excursion, you can see how the distal cusps of both molars are trying to track through the grooves on the opposing tooth. And look at the mesial buccal cusp of the Pontic, how it will track mesial to the mesiolingual cusp of the opposing molar. And if we go into a working excursion, you can see that the Pontic cusp tips are riding through grooves, while on the second molar we're going to have a little bit of a problem because the ridges want to pass over the cusp tips. So we're going to have a little problem in keeping that out of a working interference. And we may have to modify the opposing teeth slightly as we go through this wax up in order to get good function. And this is not uncommon. We often have to do this for patients. Now that we have located the buccal cusp tips of the lower teeth, we want to locate centric stop areas for the maxillary lingual cusps in the restoration. Now the way we will do that is we will close the articulator and examine the area that the maxillary lingual cusps are approaching. What we want to capture is just the cusp tip just the very cusp tip in wax of the mesiolingual and distal lingual of both molars and the cusp tip of the second bicuspid. So as we close this articulator, we start to approximate the area that we are going to have to locate a cusp stop. The maxillary second bicuspid will be stopping in the area of the distal marginal ridge of the lower bicuspid. You can see right here, it should be right along the distal marginal ridge. The stop for the maxillary mesiolingual cusp should be right here, the first molar, the distal lingual cusp here, and then of course we would have the mesiolingual cusp of the second molar and the distal lingual cusp of the second molar. So we'll start by very similar to what we did in locating the cusp tips. We will build up a cone of wax and then close the articulator and test it in its excursions to see if we have just the cusp tip of the opposing tooth captured. So now that we have placed a little on that bicuspid, we'll close the articulator move it from centric relation to centric occlusion and examine what we have. And if we look at the top area, we note that we have no contact there as yet. So we'll build it up just a little bit higher. And close the articulator again. Test it from centric relation to centric occlusion. And open the articulator. And here you can see now that we have a contact on the cone of wax that we had placed. Now we want to verify that indeed it is touching the cusp tip of the maxillary second bicuspid. So we'll close the articulator down, and then we will have to look in through the lingual to examine our cusp placement. Here you can see from the lingual view that the stop that we have placed in the distal marginal ridge area is too far to the distal. It is not capturing the lingual cusp tip of that maxillary second bicuspid. It just contacts the distal cusp bridge when we come into a centric occlusion position. There is no centric relation stop. So what we're going to have to do is move that stop more mesially, more into the central fossa of the lower bicuspid. Flow a little more wax now that we have a better idea where we're heading into the area that we are trying to generate a stop. You notice I'm going to leave that initial stop there in this particular instance as a guide for where I want to put my wax. Now I've built up some more wax in that central area. Again, we will close our instrument, move it from centric relation to centric occlusion, and now you can see the stop is what we're looking for. Right here, you can see a small area that has been burnished into the wax as we move from CO to CR. And if we close the instrument and examine it from the lingual aspect, you can see that the cusp tip of the maxillary second bicuspid has been captured in that stop area. We're going to pick up a little bit more of a stop in the distal marginal ridge area, but look at the cusp tip of that maxillary bicuspid. It is riding on that wax. We have a stop from CO to CR, and that's what we want. Now, in a similar fashion, we are going to generate stops for the maxillary lingual cusps, or for the lingual cusp of the maxillary molars. Okay, you can see now that we have placed the stops for not only the bicuspid, but we've come down and placed the stop for the first molar on the Pontic area. Here's the mesiolingual cusp, distal lingual cusp, and in the distal retainer, we have the mesiolingual cusp of the upper second molar, distal lingual cusp of the upper second molar. And you can see from the lingual now that we have the maxillary molars coming into these rather flat stop areas, and you can see as we move back and forth, we have a stop in the centric occlusion and centric relation. Now we'll locate those lingual cusp tips, and the second bicuspid is a two-cusped bicuspid, the mesial lingual cusp being the larger of the two. So we will start to locate that along the mesial aspect of the lingual cusp, and then a smaller distal lingual cusp. This will be your typical Y-shaped second bicuspid, which you're all familiar with from dental anatomy. And the reason we're going to use this shape for the bicuspid is because that's what is on the contralateral side of the arch. Once we have those two cusps located, Now we will want to check this and make sure that we will not have them too high and not placed in a working interference. So what we will do now is close the instrument, and by viewing from the lingual, test to see that we can come out and clear the lingual cusp in a working excursion. And here you can see as we come out in a working excursion that we will actually clear between those two cusps. This is on a slight angle, so it may look like we're very, very close to that mesiolingual cusp. In reality, we have a little more room than that. So now we will continue to locate the rest of the lingual cusps for the pontic and molar in the same fashion. Now we've placed the rest of the lingual cusp tips, and you can see we've placed the lingual cusp tips on the pontic and the distal retainer, and we are now starting to develop, with the buccal cusps in place and the lingual cusps, the curve of Spee and the curve of Wilson. You can see the curve of Spee developing along the buccal area. You can see from this direction that we are starting to develop the curve of Wilson, the buccal cusp tip up here higher than the lingual cusp tip, and the curve of Wilson developing as we go from a buccal to a lingual direction. If we view the cusp placements from the lingual, you can see that the maxillary molars are sitting on their stops. As we go into a working relationship, the mesiolingual cusp of both distal retainer and pontic are in the embrasure areas where they cannot form a working interference, and the lingual cusps are tending to run through the lingual developmental groove of the upper molars. And this will provide clearance for the distal lingual cusp. We'll start in the bicuspid area, and we will just start to flow the cusp bridge. We'll come right down the distal cusp bridge to the distal buccal point angle, turn it into a marginal ridge, and go lingually, forming that distal marginal ridge. Now we have a stop along that distal marginal ridge, so we don't want to raise it in that area. Then we will continue across that to the lingual, form that lingual point angle, and the lingual point angle here is very, very indistinct. It's just a little bit to the distal and lingual of that lingual cusp tip. And there you can see that we have tried to indicate that. You see just a little curvature, point angle developing right in here. And that started up that distal incline, that point angle up the distal incline of that lingual cusp, and now we will perform the lingual incline, leave a bit of a notch to start developing the lingual developmental groove, put the distal incline of the mesiolingual cusp in. If we drop a little bit too much wax in here, we can just right now form a little bit of a notch between those before we lose our landmarks and just reflow that. Now we'll come down the lingual cusp bridge, form the mesiolingual point angle, and start developing the mesiomarginal ridge. All right, we've come down that mesiolingual cusp bridge to the lingual point angle, turn at the point angle, go across, form the mesiomarginal ridge, come out to the buccal point angle, and then we'll go from the buccal point angle back up to the cusp tip, and we have performed a formation here of the buccal cusps and marginal ridges for the mesial retainer. If we look at the mesial buccal point angle, we can see that that is lower than the distal buccal point angle of the first bicuspid. So obviously we're a little bit low in this area, so we're going to have to build that up to correct that. And bring that up right into our cusp tip so we start developing the proper shape to the cusp. Okay. Now we've raised that mesial buccal point angle up, and you can see it's now the same height as the distal buccal point angle of the first bicuspid. And you can see that we have a point angle developed on the distal. And if we turn this around, you can see that the marginal ridges are developed and the cusp ridges of the lingual cusps. And from a lingual view, okay, the lingual cusps have their height and shape determined, and now we just want to progress right along, do the same thing with the pontic and the distal retainer. All right, you can see now that we have finished placing the cusp ridges and marginal ridges on both retainers and the pontic. During this process, we have tried to keep in mind the cusp height, cusp angulation, and point angle delineation of marginal ridges. So here you can see, if we take this and if we look across from our lingual aspect, and you can see that these lingual cusps are fairly sharp. Here, if we come in the distal lingual cusp, you can see it's fairly sharp. Mesial lingual cusp again, fairly sharp. And on the pontic, the lingual cusps, mesial retainer, fairly sharp. Now if we compare that with the lingual cusps on the other side of the arch, here's the lingual cusps on the second bicuspid, and you can see the rather small distal lingual cusp, larger mesial lingual, and you can see the lingual cusps are fairly sharp. If we look at the buccal cusps on the wax up, here you can see the buccal cusp on the second bicuspid is fairly sharp. The buccal cusps on the pontic, the middle buccal cusp is quite sharp, as is the distal buccal cusp. The mesial buccal cusp is a worn look to it. It's been flattened off. If you look at the buccal cusps on the second molar, the mesial buccal cusp is very flattened, and the distal buccal cusp we have a little sharper, but again, it's quite blunt. Comparing that with the other side of the arch, you can see that the buccal cusp on the bicuspid is quite sharp. The first bicuspid, you can see a fairly blunt mesial buccal cusp, a sharper middle buccal, and again a fairly blunt distal cusp. And look at the second molar, a very, very blunt mesial buccal cusp and a very blunt distal buccal cusp. Here we have a kind of a separate hump on this, which we didn't show on the other side. But we're trying to match what the patient had. So we are satisfied now that we have matched what the patient had. We're satisfied from a functional point of view, and so now we're ready to put in the axial surfaces. As those marginal ridges were formed, we did not lute the retainers to the pontic. So we can actually now pop the retainers out by removing the dies here. And there the pontic will stay right there. And now we can work out in our hand to put the basic axial surfaces on the retainers. Once that is completed, then we will put those in and finish the axial surfaces on the Pontic. And now, with the information that you have gained by pacing your cusp ridges and marginal ridges, we're going to fill in the axial surfaces with retainers. So we're starting here on the distal buccal cusp of the second molar, and we'll just start building up, cusp by cusp, our axial surfaces. And of course we'll have to place this back into our instrument to check this after we have what we think is a decent axial surface. And remember now, because our patient has a worn anatomy, we are replacing a worn anatomy. So the buccal developmental groove here is going to be well defined, but the cusp ridges are worn down. So we're not going to have the nice sharp cusp delineation that you had in your practice wax up exercise, but we're going to adhere to some of the same rules. We're coming from that mesial point angle and dropping back to the midpoint of the mesial root. That's our height of contour, remember. So we're trying to build that up. And we'll finish now the contour at mesial buccal cusp. And developing that buccal developmental groove between these two cusps as we build it up. And here you can see our initial buildup of that buccal surface. You can see that we do have indicated buccal groove. We do have a height of contour coming from that mesial point angle back to the midpoint of the root. And we're starting to develop the height of contour. This is kind of a more rounded area on the distal. And we'll just continue around and build this up. Now we have completed the axial wax ups. You can see that we've added the axial contours to the bicuspid, and we have the lingual developmental groove indicated. We have the axial contours placed on the molar retainer. There's the buccal developmental groove and the lingual developmental groove. And now we're going to try these back into our model and make sure that the contours that we have established are the proper ones. So when you put this in, if you have been careful and have not extended beyond the cusp ridges and marginal ridges that you had established, these should slide in without hanging up. Now be careful, particularly with the bicuspid. When you drop that in, you may have to adjust the mesial contact or the distal contact area in order to get that to go into place. And now we have placed the dies and the wax patterns in the model, and we are starting to examine whether or not we have the contours that we had established. If we look across the buccal cusps, you can see that the buccal cusps are rather flat on the molar retainer, and the bicuspid has a well-developed buccal cusp. You can see the proximal over contour on the distal now of the bicuspid. You can see that over contour down there at the margin. You can see the over contour at the marginal area of the molar retainer at this time. We're just leaving those a little bulky. The lingual cusps, we have a fairly sharp lingual cusp. Remember we talked about this? Indicated that these would stay fairly sharp. Start putting some axial contours. I like to start in this middle buccal cusp. And we'll just flow some wax, remembering that we're going to start developing the buccal developmental grooves at this point. The Pontic has a rather normal axial contour for its occlusal 2/3. The gingival 1/3 will be modified to form a sanitary Pontic. And here we've placed some wax along that. Now we're going to start looking at our contour. You can see we're a little bit flat in the cusp that we just worked on right up here towards the occlusal. So we'll add to that just a little bit, and then we'll go on to the mesial cusp. There you can see we've tried to develop this height of contour coming from the proximal point angle, and it comes down to what ordinarily would have been the mesial root. With the two mesial buccal cusps pretty well developed, now we're going to do the distal cusp simply by adding some wax to form this contour. And be careful not to hit your adjacent retainer and develop that developmental groove at the same time. From the mesial aspect, you can see that the first bicuspid is here, second molar is here, they line up, and as we get to about the junction of the cervical and middle third of the Pontic loses its contour and starts curving in towards the ridge. So that means, as we look down from the occlusal, the Pontic will appear narrower than the natural tooth on the other side, because if we look down here, this is what we register in our mind as width, and remember, this is at the junction of the middle and cervical third. And if we look over on the other side of the arch, what we're seeing as the width of this molar is right down next to the gingiva. So we're looking at the end of the gingival third down here, and we have to judge our width a little higher up on the tooth. So that's why this Pontic appears a little narrower than the tooth on the other side. So now the buccal contour is established. This is what we want for sanitary Pontic. And we will come back now and do the lingual surface. And we will simply flow wax into this area, developing the lingual developmental groove area, and the height of contour on the lingual cusp of the lower molars is at the junction of the occlusal third and middle third. It's higher than it is on the buccal. So our height of contour is going to be much higher, and it will not affect our perception of the width of this tooth. So now that we have flowed in the lingual surfaces, now you can see the proximal surfaces are incomplete. And in order to flow those in to get that contour, we will again take out the retainers and correct our proximal surfaces. We just pick up some wax, don't alter the marginal ridge that you now have established, come down that proximal surface and establish the contour of your Pontic on the proximal. Now you're going to be able to get at this better when the Pontic is removed for casting, just prior to casting. But you still want to come down and make these proximal surfaces fairly well developed at this point. Okay, now we have waxed in those proximal surfaces. You can see now we have a little better shape to our Pontic. And at this point, we will examine all of our proximal or axial surfaces the sharpness of cusps, the placement of cusps, and be sure that we are happy with these before we go on and start to develop the occlusal anatomy. You know that the triangular ridges are broader at the base than towards the cusp tip, and we'll start flowing the wax in, and we will visualize where we're going to place the developmental grooves and supplemental grooves as we do this, and try to leave those areas so that we form the groove simply by not adding wax in that area. So I'm coming down here, I'm putting in the triangular ridge, mesial-buccal cusp, second molar. You see we're trying not to involve the stop area, and now we can close the instrument. Move it into excursions and take a look. And you can see here that we've had some contact of the wax, so we have a little bit more wax in that area than we need. So we can simply carve this back slightly. And then we will reflow it and go through the process all over again. Flow that in. Now you can see we've established a triangular ridge that is not in interference. So the basic ridge is there. We of course have to smooth it up a little bit. But once we have our basic triangular ridge in, we'll go back and place the triangular ridge on the next cusp. And you want to keep testing at this point. You don't want to start raising the vertical of your case on wax. That will cause you to break your wax pattern. You can see here we have an area of interference. And again, we'll take some of the excess wax back and simply reflow that. We'll put all the buccal triangular ridges in first, so now we'll progress up to the first molar. And here we're coming down, putting in, remember, the height of contour first, so we're going towards the central pit from the cusp tip. And then we will broaden out the base to the mesial to establish that triangular ridge. And this is one that we should have very little problem with interference on, because there's nothing really opposing that area. So here you can see that we've placed that initial triangular ridge. Now we'll go to the middle buccal cusp. We should not have any indication of scrubbing on the triangular ridges that we have placed. You can see here we're a little bit tight, a little close here, and a little bit there. So as we continue to develop the wax pattern, of course, we will correct that. But right now we're close enough to continue on with our placement of the triangular ridges. Now we'll go to the lingual triangular ridges, and these will be done in the same fashion. Okay. We now have placed all the triangular ridges, and you can see the triangular ridges along the buccal cusps and the lingual cusps. And you notice the area between the triangular ridges are just voids at this point. We have not started placing the supplemental ridges yet. And if we close the articulator and test it, come back and examine our occlusal surfaces, we should see that essentially we have the stop areas and there are still some small areas which may indicate some interferences close to centric that as we finish this wax up we'll eliminate, such as this area, possibly in the freedom and centric motion is a little bit tight, but we're in pretty good shape. So, as you're aware, the supplemental ridges are placed so that the base of the supplemental ridge is towards the cusp ridge and the apex of the supplemental ridge is towards the central groove area. So the bicuspid has a supplemental ridge right beside its buccal triangular ridge. And we come down, if we get a little bit wide and involve some of that triangular ridge, we just come back in, strike the groove that we want, and add some more wax to form the supplemental ridge. Now, most of these supplemental ridges will not be involved in occlusion. For ease of working, you can actually take the dies out of the model and place the supplemental ridges if you prefer. But you have to remember to periodically put them back in and do tests through the excursions, because you can run into some problems in the excursions. But for the most part, these will not interfere with occlusion. See if we can get this one finished up. Okay, we have now placed the supplemental grooves in both retainers. You can see that we have come up with a completed anatomy in both the retainers. We are now ready to complete the anatomy in the Pontic. If you're in a hurry, you could actually cast your retainers at this time and complete the Pontic wax up while these retainers are burning out. We're just going to show you how to finish up the Pontic wax up here. It's very same process as the retainers. We're going to start out with a supplemental ridge on each side of each triangular ridge. We'll start up here on the mesiolingual cusp. Placing our supplemental ridge, and remember that the base of the supplemental ridge is towards the cusp ridge, and the sharp apex or point of the triangle is towards the central groove. Here you can see we've put in a supplemental ridge, and there we're refining the limits of it. And now we will bring it up to its final contour. And if we have to refine the triangular ridge on the other side, we can. And as you know, there's not any occlusion in this mesial facet to speak of, so we're just going to go ahead and come right around here and form the two lobes of the marginal ridge and the supplemental ridge mesial to the mesial buccal triangular ridge. And we're going to continue with this plan right around the tooth, just as we did the retainers. It is the same process. Here we've been working on going around the perimeter of this tooth with the supplemental ridges. As you can see that we have them all in, but the last two on the lingual cusp. And we just are going to flow these in now. And then our wax up will be completed. You notice that we have good anatomy here, and the anatomy will go hand in hand with good function. Here. We can check this by dusting the wax pattern with zinc stearate, and we want to put a nice thin layer, even coat of the zinc stearate on, and then any area that is rubbing will show through as bright wax. So we can check this now by closing the instrument. Now you can see that we have a stop here on the, for the mesiolingual cusp of the second molar. Distal cusp does not show up as well, but it is there. Here's the distal cusp of the first molar, and the stop for the mesiolingual cusp is right in here, and you can see the stop for the lingual cusp of the second bicuspid here. Not showing up quite so clearly on the picture, but it's there. Here's your stop for the mesiobuccal cusp tip, middle buccal cusp, and here's the stop for the buccal cusp. So we have some adjustments to make. Here we have a little lack of clearance in the groove, so we're going to want to thin this stop area out here and this stop area also here, same problem. And we can make those adjustments a little bit in the wax before we cast, and we can of course make the final adjustments in the castings. So we'll make some small adjustments here, and then we're ready to invest these patterns.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.